Hi everyone, I'm Dr. Emma. In the previous episode, we talked about why men don't need to worry about the size of their penis. The reality is that the vast majority of men fall within the normal range. But I know many of you are still wondering, could it be a little bigger? Are there any exercises or treatments that actually work? So in today's video, we're going to look at what medical science says about penile enlargement and which methods may actually help. As always, this video is for educational purposes only. If you're seriously considering any treatment, please consult a qualified healthcare professional before trying anything on your own. Let's get started. You've probably heard me say this before. For many men, the issue isn't that the penis is too small. It's that part of it is hidden beneath excess fat in the lower abdomen and pubic area. A significant portion of the penis actually extends inside the body. When fat accumulates around the pubic region, more of that internal portion becomes buried, making the visible part appear shorter. That's why losing weight can sometimes make a noticeable difference in apparent penis length. If you're overweight or carry excess fat around your lower abdomen, improving your diet and increasing physical activity may be the safest and most effective first step. The best part? Weight loss doesn't just improve appearance. It can also improve erectile function, cardiovascular health, energy levels, and overall sexual performance. So before considering any device or surgery, start with the basics. A healthier body often leads to a healthier sex life. Next, let's talk about one of the most commonly discussed surgical procedures. The penis is attached to the pubic bone by a structure called the suspensory ligament. The idea behind this surgery is simple. By cutting that ligament, a portion of the penis that normally remains inside the body can extend outward. On average, studies suggest patients may gain approximately half an inch, or around 1 to 1.5 centimeters in visible length. Sounds promising, right? Well, not so fast. Patient satisfaction after this procedure is often lower than expected. Why? First, the erection angle may change. Because the ligament helps support the penis during erection, removing it can cause erections to point downward. Second, results can be unpredictable. Some patients don't achieve the increase they hoped for. And third, the loss of support can make the penis feel less stable during intercourse. So while the surgery can increase visible length, it's important to weigh the potential trade-offs before considering this option. Now let's move on to vacuum erection devices, often called penis pumps. These devices consist of a clear plastic cylinder placed over the penis and connected to either a manual or electric pump. When air is removed from the cylinder, a vacuum is created. That negative pressure pulls blood into the penis, causing it to expand and become erect. For men with erectile dysfunction, this can be an effective, non-invasive treatment option. But the question everyone wants answered is, can it permanently make your penis bigger? The short answer is no. Research shows that penis pumps can temporarily increase size because of increased blood flow. However, once the device is no longer being used, the penis returns to its normal size. Even studies that followed men using vacuum devices regularly for several months found no significant permanent increase in length or girth. So while a penis pump can make you look larger temporarily, it does not create lasting structural changes. Its primary medical role remains the treatment of erectile dysfunction rather than penile enlargement. If your goal is a stronger erection, it may be useful. If your goal is permanent enlargement, this probably isn't the solution you're looking for. Among all non-surgical options, this is probably the one with the strongest scientific support. Penile traction devices work on a principle similar to orthodontic braces. Instead of moving teeth, they apply gentle, continuous stretching forces to penile tissues over time. A typical device has a ring at the base of the penis, a support structure, and a mechanism that secures the glands while providing controlled outward tension. The goal is to stimulate tissue remodeling and growth through prolonged mechanical stretching. Unlike a penis pump, which creates temporary enlargement through blood flow, traction devices aim to create actual structural changes. And that's an important distinction. Several clinical studies have reported modest but measurable gains in penile length after consistent use over many months. The key word here is consistent. These devices require patience, commitment, and realistic expectations. You don't use them for a week and suddenly gain an inch. Results, when they occur, typically require months of regular use. If someone is seeking a non-surgical option with the best available evidence for increasing penile length, traction therapy is probably the most reasonable place to start. It isn't quick, it isn't effortless, but among non-surgical approaches, it may offer the greatest potential for permanent structural change. Here's a point many men overlook. Sometimes the issue isn't size, it's erection quality. A penis that isn't fully erect can appear significantly smaller than its actual potential size. That's where a penis ring, also known as a constriction ring, may help. A penis ring is worn around the base of the penis and works by slowing blood flow out of the erectile tissues. This helps maintain a firmer and fuller erection. For men who can achieve an erection but struggle to maintain one, a penis ring can make a noticeable difference. Many men report improved rigidity, better confidence, and a fuller appearance during sexual activity. Penis rings are also sometimes used alongside medications such as Viagra or Cialis. However, it's important to remember that penis rings do not permanently increase size. What they do is help maximize the erection your body is already capable of achieving. For some men, that alone can create a surprisingly large visual difference. If you're hoping to increase penile size, it's important to focus on methods that actually have scientific support. For many men, the most effective starting point is 1. Maintaining a healthy body weight, 2. Optimizing erectile function, 3. Considering medically appropriate traction therapy. These are currently among the most evidence-based approaches available. Be cautious of miracle products and exaggerated marketing claims. When it comes to penile enlargement, if something sounds too good to be true, it probably is. And if you're considering more invasive options such as surgery, make sure you have a thorough discussion with a qualified specialist before making any decisions. I'm Dr. Emma. In the next episode, we'll talk about something many people are just as curious about. Not length, but girth. Can penis thickness be increased? We'll explore what the science says next time. Thanks for watching, and I'll see you in the next video.